Welcome to the training session on the event-level COVID-19 vaccination form for long-term care facilities. My name is Audrey Robnett-Brown, and I work with the Division of Healthcare Quality Promotion at CDC. Before we begin, as a general reminder, please contact CMS with questions about reporting requirements using the email address provided on the slide. Let's start by reviewing some key points. The event-level COVID-19 vaccination forms are an optional tool that can be used to report data to the main weekly HCP and resident vaccination modules. Facilities will continue to submit weekly COVID-19 vaccination cumulative summary data by completing questions on the COVID-19 weekly vaccination modules. But as of March 28, 2022, facilities also have the option to use the event-level COVID-19 vaccination forms and select the View Reporting Summary and Submit button to submit these data to the weekly modules. These are new and improved versions of the Excel data tracking worksheets that are currently posted on the NHSN website. The Excel data tracking worksheets will be retired in May 2022. The optional event-level COVID-19 vaccination forms are available in the NHSN application for Level 3 users, and we will discuss this in the presentation. Level 3 access is required to use the optional event-level COVID-19 vaccination forms. To request Level 3 access, please contact NHSN at cdc.gov and place in the subject line, SAMS Level 3 access. This is not a new requirement. The optional event-level vaccination forms are meant to simplify reporting. Data is entered line by line in the optional event-level COVID-19 vaccination forms, similar to the Excel data tracking worksheet. You must select View Reporting Summary and Submit button each time a change is made. The main objective of today's webinar is to provide an overview of how to use the new event-level vaccination forms in the NHSN module. We will review how to enter data in the event-level COVID-19 vaccination form. We will review the functionality of the CSV Upload into the new event-level form. We will walk through some example scenarios, and we will discuss commonly asked questions. Please note that the slides, QRG step-by-step guide, and CSV template are posted to the NHSN COVID-19 vaccination website. Providing a little background about the COVID-19 weekly reporting, long-term care facilities can report COVID-19 data to CDC's National Healthcare Safety Network weekly for residents and healthcare personnel. These data include counts of residents and healthcare personnel or staff who received any COVID-19 vaccine. To track individuals' vaccination information, we currently provide 2 Excel spreadsheets named the data tracking worksheets. An enhanced version of this, called the event-level vaccination form, has now been built into the NHSN application. Similar forms for non-LTC COVID-19 vaccination modules are coming soon. There are many advantages to using the new event-level vaccination forms in NHSN. The event-level vaccination form simplifies reporting of summary data for the users. The NHSN application automatically calculates and displays the weekly totals. Users who elect to use the event-level vaccination forms will no longer need to manually calculate and enter totals in the summary forms. Users simply update the person-level data and use the reporting summary to review the totals and submit their weekly data. The event-level vaccination forms also captures changes in individuals' vaccination status over time. The event-level vaccination form also allows users to record religious exemptions. Let's start with a general overview of the event-level COVID-19 vaccination form. Now we will go over how to access the event-level COVID-19 vaccination form in the NHSN application. First, you will go to the NHSN Long-Term Care Facility Component homepage. Next, go to the COVID-19 tab located in navigation bar on the left-hand side of the page. Then you will select the Event-Level COVID-19 Vaccination Form for either healthcare workers or residents. For this presentation, we will be reviewing the Event-Level COVID-19 Vaccination Form for residents, but the same steps can be applied to the healthcare worker form. Please note that these data are only for illustrative purposes and are not intended to reflect any actual facilities or individuals' names. To begin entering data into the Event-Level COVID-19 Vaccination Form, you will first click Row. Second, you will enter all required data. Third, you will click Save Row. As a note, please make sure you click outside of the cell you last edited before saving and submitting your entered data. Otherwise, the data in that cell does not save. You will continue to add residents to the form by selecting the Add Row button. Each row will remain green until the data are submitted. Please note that the green row means any new or updated data that has been entered has not yet been submitted to the weekly summary form for all applicable weeks. After all required data are entered into the form, you will click the Review Reporting Summary and Submit button. After you have clicked the View Reporting Summary and Submit button, you will see this screen. Use the Data Collection drop-down box to select the week you want to submit weekly summary vaccination data for. In this example, we are submitting summary data for the week beginning 3/7/2022. Once you click the week of interest, review the totals for that week to make sure they appear as expected. Note that the weeks have labels that indicate whether the data for that week was updated and needs to be submitted. If the label says changed since submitted using the tracking worksheet, this means that the data has been modified since the last time you submitted using the event level form, so you should resubmit the data for that week. If the label says never submitted using the tracking worksheet, this means that you have not previously used the event level form to submit data for that week. Both of these statuses indicate that you should submit or resubmit the data for that week. After you have submitted the data for the reporting week, you will see that the text goes away as seen in the screenshot on the right side. This means that there have been no changes to the data for that week since the last time you submitted. Once you have reviewed the reporting summary and confirmed that your data are correct, click the Save and Submit Data button indicated by the red box, and a successfully saved alert will appear. Please click OK to continue. You will see that the week 3/7/2022 no longer includes the text changed since submitted using the tracking worksheet. Repeat this process for all weeks that have new or modified data. Always check the calendar view to confirm the weekly data have saved. To confirm that your data for that week successfully saved, you can click the Vaccination Summary tab on the left-hand navigation bar to view the calendar on the weekly vaccination summary data page. Here you will be able to view that the record is complete and successfully saved as indicated by the record in green. Some of the fields in the event level vaccination form are required in order to save. For all individuals, you must enter the resident or healthcare worker identifier. This is a unique identifier for the individual signed by your facility. The admission or start date, first name, last name, at least one status. This means each person must be classified into at least one of the main status categories, such as partial or complete primary series vaccination, contraindication, declined, or unknown vaccination status. Next, we will review how to transition your current Excel data tracking worksheet to the NHSN event-level vaccination forms. Please note that this only applies to users who have been using the Excel worksheet. The next section will include data on the Excel data tracking worksheet and the NHSN event-level vaccination forms. Text references on the slides for the Excel worksheet are indicated in brown, and references to the NHSN event-level form are indicated in green. The NHSN event-level vaccination forms are replacing the Excel data tracking worksheets. To make sure that the switch from using the Excel worksheet to the NHSN event-level vaccination forms, you can perform a one-time upload of your data from the Excel worksheet. It is important that you only upload the Excel worksheet once, because there are key differences between the Excel worksheet and the NHSN event-level vaccination forms. To prepare your Excel data tracking worksheet for upload, first, make sure you are on the tab labeled Tracking Worksheet. Then select the most recent week with updated data from the Reporting Week drop-down menu. Last, confirm that your data are accurate and up-to-date and ready for upload. Now you are going to save the Excel data tracking worksheet as a CSV file by selecting Save As from the File menu. Then select either of the CSV, delimited file names listed on the slide, then click Save. You will see this pop-up box appear. Please select OK to proceed. Now that your file is ready for upload, first, on the NHSN event-level vaccination form, you will click Upload CSV in the above data entry table. Second, you will click Browse to locate the saved file. Once you have selected the file to upload and it is visible in the Browse box, you will then click the Upload CSV button indicated by the number 3 on the slide. After clicking the Upload CSV button, you will see a message appear on your screen indicating that the CSV file has been uploaded successfully. Then click OK to continue. To check your record, you can click the Vaccination Summary tab on the left-hand navigation bar to view the calendar on the weekly vaccination summary data page. Here you will be able to view that the record is complete and successfully saved as indicated by the record in green. Let's review the Export CSV option. Note, exporting and importing is optional. We recommend not exporting and importing. All data can and should be maintained within the NHSN event-level COVID-19 vaccination form. Once all data has been entered or uploaded into the event-level COVID-19 vaccination form, you can click Export CSV as indicated by the orange box on the slide. You will then see a message box that appears as shown in this slide, and you will select Open to view the CSV file. Your exported CSV file will look like the example provided on this slide, and you will be able to save it for your personal records. Note that your data does not need to be exported because your records will be maintained in NHSN, but if you choose to keep the exported record, please be sure that the record is saved as a CSV file. You may also save this exported CSV file and use it to upload your data into NHSN, although it is not recommended. It is important to know that each time you export data to a CSV file and use that file to import or upload data into the event-level COVID-19 vaccination form, you will be required to resubmit all uploaded data. If you want to import a CSV file, please follow these steps to ensure that your exported CSV file is successfully uploaded. First, you will click Upload CSV in the above data entry table. Second, you will click Browse to locate the saved file. Once you have selected the file to upload and it is visible in the browse box, you will then click the Upload CSV button indicated by the number 3 on the slide. Keep in mind that all weeks modified by CSV Upload will need to be resubmitted using the View Reporting Summary and Submit button. We will now summarize a few key differences between the Excel data tracking worksheet and the NHSN event-level vaccination forms. These differences will be important to keep in mind as you transition to using the NHSN event-level vaccination forms. Let's discuss some key features that are unique to the NHSN event-level vaccination forms. At least one status has to be entered for each individual. There's a new question, reason for declination. This allows you to record if an individual declined vaccination due to receiving a religious exemption. An individual can have more than one vaccination status entered because their status can change over time. All information should be recorded over time and should not be deleted if an individual's vaccination status changes. If an individual leaves the facility for more than 2 weeks and later returns, use the plus button to duplicate their original row. Enter an end date on the original row, that is the last day before leave, and a new start date on the new row, that is the first day returning after leave. We will walk through an example of this in the next section of slides. Now I am going to highlight an important difference between the Excel worksheet and the NHSN event-level vaccination form. In the Excel worksheet, any individual entered on the spreadsheet without an assigned status is categorized in the unknown category on the Reporting Summary tab. However, if an individual is uploaded without any status to the NHSN event-level COVID-19 vaccination form, you will have to categorize them in NHSN with an unknown vaccination status date before you can save and submit to the reporting summary. Additionally, in the NHSN event-level COVID-19 vaccination form, if an individual declines COVID-19 vaccination, you will enter the date they declined and the reason for declination. The options for reason for declination include receiving an official religious exemption from the facility, other, and unknown. We will now review some of the example scenarios. Let's discuss if someone leaves or discharges and later returns to the facility. If someone leaves the facility and returns in 2 weeks or less, this is not considered extended leave, and their information can continue to be maintained on the original row. If someone goes on leave or is discharged for longer than 2 weeks, they should have an end date entered on the day they begin leave or day of discharge. Their row should be duplicated, and their start date on the new row is the day they return to work or are readmitted. Let's review an example of how to update a resident that is readmitted greater than 2 weeks after discharge. In this example, we are updating the record for resident ID 2345, who discharged from the facility on February 1st, 2022. We'll start by finding the resident in the table and clicking the button to duplicate the row, as shown in the red box on the screenshot here. In the new row, delete the admission and discharge date and add the new admission date. In our example, resident 2345 was admitted on March 25th. This information is updated in the section outlined by a yellow box on the screenshot shown here. Ensure the vaccination information is up to date and click Save Row. What if I need to update a record I previously saved? Well, previously saved records can be updated by entering the changes directly into the grid of the record. This option has been highlighted with a red box. Do not forget to always view reporting summary and submit for all weeks impacted by a change. Unlike the current Excel tracking worksheet, each individual can have more than one status recorded because an individual status can change over time. Let's look at an example. Suppose you have an existing record for resident ID test 6. This individual was admitted on 2/21/2022 with an unknown vaccination status. This is shown in the screenshot above under number 1. Then over the course of their week at your facility, you find out they are unvaccinated and offer vaccine. They decline on 2/25/2022. You would update this record as indicated in box number 2. Simply click into the cells to update. Do not forget to always view reporting summary and submit for all weeks impacted by change. As time goes on, the resident changes their mind, and on 3/22, they agree to receive their first dose of COVID-19 vaccine. This can also be updated in the same way. Click on the cell corresponding to dose 1 and provide the date and vaccine manufacturer name. As always, after making updates or adding new data, please click the View Reporting Summary and submit for all view weeks impacted by a change. You will repeat this process once again once the individual receives any additional or booster dose. Now we will review if someone has a medical contraindication after receiving dose 1 of a 2-dose primary series. Suppose at your facility, an individual received the first dose of an initial COVID-19 vaccine, but had a severe allergic reaction following the vaccination. As a result, the individual did not receive the second vaccine dose. This individual will be counted as medical contraindication in a reporting summary. In the event level form, you can now enter the information on an individual's contraindication and single dose vaccine. When you select View Reporting Summary and Submit, you'll note that this individual is only counted as a medical contraindication and not a partial dose. As seen here, the individual shown on the previous slide will be counted as a medical contraindication to the COVID-19 vaccine rather than as receiving dose 1 of Moderna. Let's review this question. What if someone completes their primary series after reporting a medical contraindication? If this individual were to later receive their second dose of a 2-dose primary series, even after reporting a severe allergic reaction, you would need to delete the contraindication date in order to save the dose 2 information. Failure to do so will result in the error shown here. We will now go over some commonly asked questions. Can we still use the current Excel data tracking worksheet? You can still use this for now, but it will not be maintained after May 2022. We encourage users to switch over to using the new optional event-level vaccination forms in the NHSN application. To do so, you will upload the current Excel worksheet once, following the steps we provided in the previous slides, and then make updates and new records within the application moving forward. If you upload the Excel worksheet for more than 1 week, the data will not be accurate due to differences in how the forms are set up. Upload of a previous Excel data tracking worksheet is not a requirement to begin submitting data to the event-level vaccination form in NHSN. Question 2, can I start entering data into the event-level COVID-19 vaccination form? Yes. The event-level COVID-19 vaccination form is available to long-term care facilities starting March 28, 2022. There's one version for residents and one version for healthcare workers. You do not need to have used the Excel data tracking worksheet in order to use the new optional event-level COVID-19 vaccination form. Question 3. If I enter incorrect data by mistake and click Save, can the row be deleted? No. Once an individual's data is entered and saved, it cannot be deleted. Data on the event-level COVID-19 vaccination form can only be updated after the row is saved. How do I submit LTC HCP data to the event-level COVID-19 vaccination form? These steps are the same as those we walked through on today's webinar, except you will be using the event-level vaccination form for healthcare workers. What if I need further instruction on how to upload the Excel data tracking worksheet in NHSN? We have developed a step-by-step quick reference guide that is available on the link listed above. The next slide will outline some additional resources that may be helpful to you. The long-term care component website contains links to a variety of training materials, including quick reference guides, training slides, and information on CSV Upload. These materials provide both event-level COVID-19 vaccination forms and weekly summary COVID-19 vaccination modules. The link on this slide will take you directly to those resources. Here I would like to review some of the key points once again. Please note, the event-level COVID-19 vaccination forms are an optional tool that can be used to report to the main weekly HCP and resident vaccination modules. Facilities can continue to submit weekly COVID-19 vaccination cumulative summary data by completing the questions on the COVID-19 weekly vaccination modules. But as of March 28, 2022, facilities have the option to use the event-level COVID-19 vaccination forms and select the View Reporting and Summary Submit button to submit these data to the weekly modules. These are new and improved versions of the Excel data tracking worksheets that are currently posted to the NHSN website. The Excel data tracking worksheets will be retired in May 2022. The optional event-level COVID-19 vaccination forms are available in the NHSN application for Level 3 users. Level 3 access is required to use the optional event-level COVID-19 vaccination forms. To request Level 3 access, please contact NHSN at cdc.gov and place in the subject line, SAMS Level 3 Access. This is not a new requirement. The optional event-level vaccination forms are meant to simplify reporting. Data are entered line by line in the optional event-level COVID-19 vaccination forms, similar to the Excel data tracking worksheet. And please remember, you must select the View Reporting Summary and Submit button each time a change is made. If you have any questions about the NHSN event-level vaccination forms, please send an email to user support at nhsn@cdc.gov. Please include in the subject line, event-level COVID-19 vaccination form. Please note the text that you enter into the subject line when you are emailing user support. It will assist in getting the ticket expedited to the appropriate group. This concludes the presentation. Thank you so much for your time. We will now have the opportunity to answer questions